Well, usually, especially for intermediate and high-risk patients, the follow-up is indicated every 3 months during the first years with cytology and cystoscopy, but we try to reduce the burden of this, the intensity of these cystoscopies, because it is an invasive procedure. Patients are not really happy with this, so we usually try to alternate, or even in some of them, if they have 4 follow-ups every year, we try to do 3 follow-ups with a biomarker and then 1 follow-up with cystoscopy plus cytology. Well, the use of biomarkers has several advantages. Among them, we can find that it's easier and faster for the patient. They just bring their urine sample, they take it to the laboratory, and they also avoid coming to the coming to the hospital for an outpatient procedure as a cystoscopy, where they have to wait before they have to do the cystoscopy, and they can also avoiding the cystoscopy. They will avoid eventual complications, like if you are doing repeated cystoscopies, urethral strictures, UTIs, sometimes hematuria, or some days with lower intravenous symptoms like dysuria or whatever. So we believe we can use biomarkers for these patients to reduce the intensity of cystoscopies and to make our patients more comfortable with the follow-up of this highly recurrent disease. The only thing is we have a very wide experience with biomarkers in our center, and I just wanted to highlight the preference of the patients when they come for the biomarker over cystoscopy, and usually patients, some of them even do not want to undergo any cystoscopy anymore, but we try to convince them that we may do, as I said, for high risk, 3 biomarkers and 1 cystoscopy per year, so we reduce the intensity of cystoscopies in a 75%, and patients are quite confident with the biomarker. If you tell the patients, because you have to explain what the biomarker is and the performance and everything and the relevance of this, and they usually prefer it over a cystoscopy.